Your knees are a silent clock, and one morning, somewhere around 4 a.m., that clock can simply stop ticking the way it used to, and you will never walk the same again. Now hold on, because I want you to sit with that for a second before you brush it off as another scary line on the internet. My name is Dr. James Whitmore, and I have spent more than 30 years with my hands on human joints, listening to knees crack, watching hips freeze, and sitting across from men and women in their 60s, 70s, and 80s who told me the exact same sentence. Doc, it wasn't the pain that scared me. It was the day I couldn't get up off the toilet by myself. So before we go anywhere, let me ask you 3 questions, and I promise you every single one gets answered before we finish. Question 1. Why does osteoarthritis pain come roaring back at 4 in the morning when you are lying perfectly still and doing absolutely nothing? Question 2. Why do the very pills you swallow to kill that pain, the ones sitting in nearly every medicine cabinet of every person over 60, quietly chew through your kidneys and your stomach lining while you thank them for the relief? And question 3, the one they've been sitting on for 2,000 years. Why did ancient physicians reach for a common stinging weed growing by the roadside, a plant your grandmother cursed, to calm swollen joints? And why did that knowledge get buried? Stay with me, because I am going to answer all 3. And if what you learn here matters to you, if protecting your ability to walk, to stand, to stay independent matters to you, then do me one small favor. Subscribe and tap that like button now, because the most important part is still ahead, and I don't want the machine to hide it from you. Let me be honest with you the way I'd be honest sitting at my own kitchen table. I am not here to sell you magic. There are no gods, no miracles, no secret rituals in this. Only biology. Only the slow, stubborn machinery of the human joint and what happens to it after 6 decades of loyal service. And here is the first nuance most people never get told. Osteoarthritis is not simply wear and tear the way a tire wears down. That phrase is a lie of convenience, and I heard doctors repeat it for years before I understood how wrong it was. Your cartilage, that smooth, glassy cushion capping the ends of your bones, is not a dead pad of rubber. It is living tissue, fed, maintained, and constantly repaired by cells called chondrocytes. Послушайте меня внимательно. Those cells work like a tiny maintenance crew, tearing down worn material and laying down fresh, all day, every day. In a healthy joint, the tearing down and the building up stay in balance. But somewhere after the age of 60, the balance tips. The demolition crew keeps working overtime, the construction crew clocks out early, and the gap between them. That is your arthritis. Now here is where the age becomes everything. At 60, your chondrocytes still answer the phone, still show up, still lay down some new cartilage, just slower. By 70, many of those cells have entered a state biologists call senescence. Back. They're still alive, still sitting there, but they've stopped doing their real job. And worse, they start leaking inflammatory signals into the joint like a broken pipe leaking into a basement. By 80, in the patients I've examined with my own hands, the joint is no longer just mechanically worn. It is chemically on fire, quietly, day and night. That is the trap nobody explains at the age of 60 when the first twinge appears. You think you have a mechanical problem, a squeaky hinge that just needs oil. In reality, you have a slow inflammatory fire, and the pills most people grab pour a very specific kind of fuel onto it. And this is the smrtelna stavka I need you to understand, because it is not really about pain. Pain is loud, but pain is not what takes people down. What takes them down is immobility. Let me tell you what I have watched happen, more times than I can count. A man of 74 develops a bad knee. It hurts to walk, so, reasonably, humanly, he walks less. He sits more. Within a few months, the big muscle on the front of his thigh, the quadriceps, begins to shrink, because muscle that isn't used melts away faster in older bodies than most people believe. Weaker thigh muscle means less support for the knee, which means more load goes straight onto the raw joint, which means more pain, which means even less walking. Back. You see the loop? That is the effect domino I want burned into your memory. One painful joint, ignored or mismanaged, quietly dismantles the whole architecture of a body's independence. And here is the part that keeps me up at night. A person who stops moving doesn't just lose a knee. They lose balance. They lose bone density because bone needs weight bearing to stay strong. And a frail, unsteady person over 70 who falls and fractures a hip. In my experience, and this is not an exaggeration, roughly 1 in 4 of them does not survive the year that follows. Not from the joint, from everything that unravels after the fall. The blood clots, the pneumonia from lying still, the heart giving out under the stress. That is the real stake here, not aching knees. The slow slide from independent to dependent, and for some, an early fatal outcome that began years earlier, with a joint nobody took seriously. I remember a woman, I'll call her Margaret, 78 years old, sharp as a tack, still doing her own crossword every morning in ink. She came to me because of her hands and her right hip, and she said something I have never forgotten. She said, "Dr. Whitmore, I'm not afraid of dying. I'm afraid of my daughter having to bathe me." That sentence is the whole reason I make these videos, because the difference between Margaret staying independent and Margaret ending up bedbound was not some expensive surgery. It came down to 2 things: what she put into that inflamed joint and what she stopped pouring onto the fire. And most of my colleagues, good people, busy people, were only ever taught to hand her the fuel. So let's talk about that fuel, because you almost certainly have it in your house right now. Walk into the bathroom of nearly any person over 60, open the cabinet, and you will find them. The little tablets for pain and swelling. The ones called non-steroidal anti-inflammatory drugs. Diclofenac, ibuprofen, naproxen. The lavushka is that they work. That is exactly why they're dangerous. They genuinely dampen the fire. They genuinely ease the ache. And so the person keeps taking them day after day, week after week, month after month, often for years, frequently without a single doctor ever sitting them down to explain what those pills are quietly doing to the rest of the body. And here is the nuance almost nobody hears in the exam room. The very same mechanism that makes those pills calm your joint is the mechanism that starves your kidneys and strips the protective lining off your stomach. It's not a side effect. It's the same effect, wearing a different mask. Right now, as you're listening to me, if you are someone who takes one of those tablets most days, there is a process happening in the small filtering units of your kidneys that gives almost no warning until it is far along. And the first whisper of it is often something as ordinary as your ankles looking a little puffier by evening, or feeling unusually thirsty, or noticing your rings feel tight. Hold on to that thought, because I'm going to show you exactly why that happens, and why the age of 70 is the precise moment it turns from a small risk into a serious one. Here is what they don't tell you in the clinic, and I say this as a man who prescribed these very pills for years before I truly understood the arithmetic of them. Those anti-inflammatory tablets work by shutting down a family of enzymes in your body, the ones your textbooks call COX, cyclooxygenase. Now, those enzymes do 2 jobs at once, and this is the whole trap. On one hand, they help produce the chemical messengers that cause pain and swelling in your inflamed knee. Block them, and the pain fades. Wonderful. But on the other hand, and here's the nuance nobody explains, those very same enzymes produce the messengers that keep blood flowing properly through your kidneys and keep a thick protective mucus lining your stomach wall. So when you swallow that pill, you are not surgically silencing the pain. You are throwing a blanket over the whole system. The fire in the knee goes quiet, yes, but so does the blood flow to your kidneys. So does the shield protecting your stomach. Back. 1 tablet, 3 effects, and you were only ever told about one of them. Now let me tie this to the age, because age changes everything here. A healthy 30-year-old has kidneys with enormous reserve. You could partially throttle their blood flow, and they'd shrug it off. But by the time we reach 60, our kidney function has already quietly declined, often by 1/3, without any symptom at all. By 70, many of the patients I've filtered through my practice are running on kidneys working at half capacity, and they have no idea, because the body gives no obvious signal until things get serious. So when a person of 75 takes daily anti-inflammatories for their aching hip, they are throttling the blood flow to an organ that was already running on a narrow margin. I have seen it in my own clinic. A patient comes in for something completely unrelated. We run routine blood work, and the numbers show kidney function has dropped off a cliff. And 9 times out of 10, when I sit down and go through their daily habits, there it is, the little painkiller, taken faithfully every single day for the joints, quietly doing exactly what its mechanism was always going to do. Послушайте меня внимательно, because this next part is the one my own colleague, a nephrologist I've trusted for 20 years, begged me to make people understand. The stomach is the loud warning. The kidneys are the silent one. When these pills damage the stomach, you often feel it. The burning, the ache under the breastbone, sometimes worse. That pain is a gift in a strange way, because it makes people stop. But the kidney damage produces no burning, no ache, no signal you can feel. It just accumulates. And the first outward sign, the one I mentioned before, is often nothing more dramatic than swelling, fluid pooling in the ankles by evening, because the kidneys can no longer manage the body's water and salt the way they used to. People blame the swelling on standing too long, on the heat, on getting old. They almost never blame the pill. That is the scritty parasite hiding in plain sight, a habit so ordinary, so socially approved, so gently recommended that nobody suspects it. And I have not even mentioned the stomach bleeding, which in people over 70 is not a rare footnote. It is a genuine cause of hospital admissions. The protective mucus layer thins, stomach acid reaches the raw wall beneath, and an ulcer forms. In an older person, that ulcer can bleed slowly and silently, so slowly that the person doesn't notice, until one day they feel dizzy, weak, short of breath climbing the stairs, and everyone assumes it's the heart, or just their age. I have watched patients get carted in pale as paper, and the cause traced all the way back to months of a painkiller taken for a bad knee. Karochi, they were trying to protect their ability to walk, and instead, they nearly lost far more. Then there's the heart itself, and here's the cruel irony. These drugs were meant to keep people mobile, and mobility protects the heart. But taken long-term, especially at higher doses, several of these anti-inflammatories nudge up blood pressure and increase the strain on the cardiovascular system. So the person taking them for their joints, hoping to stay active and protect their heart, may be quietly working against the very organ they're trying to help. My cardiologist friends have grumbled about this for years. A patient's blood pressure creeps up. They add medication, they adjust the dose, and nobody thinks to ask about the pain pill the patient never even mentioned because it's just for my knee, doctor, it's nothing. I want to be fair, because I am a physician, not a fearmonger. These medications have a place. Used briefly, a few days for an acute flare, at the lowest dose, with food, with a doctor watching the kidneys, they can be a reasonable tool. The catastrophe is not the pill taken for 3 days. The catastrophe is the pill taken for 3 years, unsupervised, as a way of life, because nobody ever offered the person anything else. And that is the Zagover Molchania I truly want to expose. It's not that doctors are villains. It's that the 15-minute appointment has no time for a conversation about lifestyle, about anti-inflammatory foods, about the slow strategies that don't come in a blister pack. It is so much faster to write the prescription. So the prescription is what gets written. And the patient walks out believing that a daily painkiller is a solution, when it is really just a very expensive way of muffling an alarm while the fire keeps burning underneath. So what did Margaret do? The woman who feared her daughter bathing her more than she feared a fatal outcome. We did the unglamorous work first. We rebuilt the thigh muscle around her joint with gentle, specific movement, because a strong muscle is the best brace a joint ever gets, and there is no pill on earth that can do that job. We looked hard at her weight, because every extra pound of body weight lands as roughly 3 to 4 pounds of force across the knee with every step. Takshta losing a modest amount takes a startling load off the joint. And then we turned to the thing that had been sitting, quite literally, in her own backyard for decades. The thing ancient physicians reached for. The thing your grandmother pulled out of the garden with gloves on and a curse under her breath. The stinging nettle. Now, before you roll your eyes and think I've wandered off into folk remedies and old wives' tales, stop. I had the exact same reaction the first time an old rheumatologist colleague mentioned it to me, decades ago. I nearly laughed. A weed? For joints? But he handed me a stack of research, and what I read changed how I think about that plant entirely. Because here is the ulovka, the thing that turns the whole story upside down. The very reason the nettle stings you, that furious burning when your skin brushes against it, is the first clue to how it may quiet the burning inside a swollen joint. It sounds like a contradiction. It sounds impossible. But the moment you understand what's inside those tiny stinging hairs, and what happens when that same plant is prepared the right way, you will understand why physicians 2,000 years ago used it deliberately, on purpose, pressed against aching limbs, and why that knowledge was allowed to quietly disappear. Let me show you exactly what's inside that plant, because this is where everything we've talked about finally connects. So let's crack open this plant and look at what's actually inside, because this is where folklore ends and biology begins. When you brush against a stinging nettle, those tiny hairs on the leaf snap like microscopic glass needles and inject a cocktail of chemicals into your skin. And among them are histamine, serotonin, and a compound called formic acid, the same irritant an ant uses. That's the sting. Now here's the twist that took me years to appreciate. When ancient physicians deliberately struck aching joints with fresh nettle, a practice they called urtication, and yes, they did this on purpose, pressing the plant against a swollen knee or a gouty toe. They weren't being cruel or superstitious. They had stumbled onto something real, that a controlled surface irritation can shift how the body processes the deeper pain underneath. Modern researchers looked at this and found that certain compounds in the nettle appear to interfere with the very pain-signaling chemicals we talked about earlier, the ones the painkillers try so hard to block. Back, the same plant, doing gently and locally what the pill does forcefully and body-wide. That is the nuance that flipped my thinking. But the sting is only the surface story, and honestly, it's not even the most important part. Послушайте меня внимательно, because the real value of this plant is not in stinging you. It's in what happens when you take the leaf, dry it or cook it or steep it, which destroys the sting completely and leaves behind something remarkable. Cooked or dried nettle is one of the most nutrient-dense green leaves on this planet, and two of the things packed inside it speak directly to the aging joint. The first is silicon. Now, silicon is a mineral almost nobody over 60 ever thinks about, yet it plays a quiet structural role in building and maintaining connective tissue, the collagen framework that holds your cartilage, your tendons, and your bones together. As we age, our body's ability to hold on to silicon appears to decline, and the connective scaffolding gets more brittle. Nettle happens to be one of the richest plant sources of usable silicon there is. I am not telling you it rebuilds worn cartilage overnight. No honest doctor would say that. But feeding the body the raw material it uses to maintain connective tissue is a very different strategy from simply muffling pain while the structure crumbles. The second thing hiding in that leaf is vitamin K, and this is where my nephrologist and my rheumatologist colleagues both perked up when I brought it to them. Nettle is extraordinarily high in vitamin K, and vitamin K does something most people have no clue about. It helps direct calcium in the body, steering it into your bones where it belongs, and helping keep it out of your soft tissues and arteries where it does not. In an aging body, calcium has a tendency to drift into the wrong places, stiffening tissues and hardening blood vessels. A leaf rich in vitamin K is, in a quiet way, helping traffic control that calcium. And here I have to stop and give you a genuine warning, doctor to patient, because this matters. If you are taking a blood-thinning medication, the older kind that interacts with vitamin K, then a sudden flood of nettle can throw that medication off badly. So this is not a help yourself freely situation for everyone. This is a talk to the person managing your medications first situation. I would rather lose your applause than see you get hurt. Now here is the part that ties it all the way back to the fire we talked about at the very beginning. that slow chemical burning inside the aging joint. Nettle leaf contains a whole family of plant compounds, including flavonoids and specific phenolic substances, and what the research suggests is that these compounds appear to dial down the body's production of certain inflammatory messengers, the specific signaling molecules, the cytokines, that keep an old joint smoldering day and night. In one line of research that a colleague first put in front of me, extracts of this plant seem to reduce the activity of a master inflammatory switch inside our cells. The switch that, once flipped on, tells the body to keep churning out inflammation. In plain language, instead of throwing a blanket over the whole system the way the painkillers do, starving your kidneys and stripping your stomach in the process, the plant appears to whisper to the fire itself, telling it to burn a little lower. That is a fundamentally different philosophy of treatment. One muffles the alarm, the other turns down the flame. And this, finally, is where the 2,000-year mystery makes sense. The Greek physicians used nettle. The Roman soldiers, marching into the cold damp of northern Europe, reportedly rubbed nettle on their stiff, aching limbs to bring warmth and relief to the joints. Medieval healers kept it in their gardens as a matter of course. For 2,000 years, across cultures that never spoke to each other, human beings independently reached for this same roadside weed to calm swollen joints. That is not coincidence. That is generation after generation observing something that worked long before anyone could explain the silicon or the vitamin K or the cytokines. So the real question isn't why did they use it? The real question is, why did we stop? And here's the uncomfortable answer. The Zagaver Molchania underneath the whole thing. You cannot patent a weed. There is no fortune to be made from a plant growing free by the roadside, a plant anyone can pick with a pair of gloves. The money, the research funding, the marketing, all of it flowed toward the compounds that could be bottled, branded, and sold. The nettle got left behind, not because it stopped working, but because it could never be owned. Caroche. It was inconvenient to the wrong people, so it quietly slipped out of the doctor's cabinet and into the category of old wives' tale. I want to be very clear, because I have watched people take good information and turn it into something reckless. This plant is not a cure for arthritis. Nothing is a cure for arthritis. Nay pills, nay surgery, nay any leaf on earth. What this plant may be is a genuine, low-cost, biologically sensible tool in a larger strategy. One that supports the joint structure, helps quiet the internal fire, and does it without quietly dismantling your kidneys and your stomach the way daily painkillers do over the years. That is not a small thing. For a person of 70 or 80 who cannot keep swallowing anti-inflammatories every day without endangering their organs, having another lever to pull, a gentler one, can be the difference between staying independent and sliding toward that fall, that fracture, that unraveling I described. But knowing what's inside the plant is useless if you prepare it wrong. And here is where I see people make a mistake that not only wastes the whole effort, but, in a few cases, causes real harm. Because there is a right way and a genuinely dangerous wrong way to bring this plant into an aging body. And the difference between them comes down to a handful of details that almost nobody explains. Get one of them wrong, and at best you throw away all the benefit. At worst, especially if you're on certain medications or you pick the plant at the wrong stage of its life, you can do more harm than good. So let me walk you through exactly how it should be done, step by step, the way I would tell my own mother. And I promise you, one of these steps is going to surprise you because it's the opposite of what most people assume. So let's do this properly, the way I'd sit and explain it to my own mother across her kitchen table. The first detail, and this is the one that surprises almost everyone, is when you pick it. Most people assume older, bigger, more established plants are stronger. The opposite is true here. The young spring nettle, the tender tops before the plant flowers, is where the good compounds sit richest and the harsh irritants sit lowest. Once the plant matures and goes to seed, its leaves develop tiny, gritty particles that can actually irritate aging kidneys. Texture, the very organ we're trying to protect, gets aggravated by the wrong harvest. Pick young, Pick the top few leaves and pick well away from roadsides and sprayed fields, because this plant pulls whatever is in the soil straight up into its leaves. That includes the good minerals, and also whatever poison a passing car or a farmer's sprayer left behind. The second detail, you must destroy the sting before it ever reaches your mouth, and heat does this instantly. Pour boiling water over the leaves for a tea, or steam, or cook them like spinach for a few minutes, and the stinging apparatus collapses completely. Harmless, gone. Please never chew a raw leaf thinking you're being rugged about it. The gentlest, safest way in for most older people is a simple infusion. A small handful of dried young leaves, or a few fresh tops, steeped in hot water for 10 to 15 minutes once a day to start. Not gallons of it, not a bucket. One modest cup, so your body, and especially your kidneys, can tell you how they feel about it before you go further. Poslušajte mě vнимательно. More is not better here. This is a plant that rewards patience and punishes greed. The third detail is the one I will not let you skip because it's where people get hurt. If you take a blood-thinning medication of the older kind, if you take pills for blood pressure, if you take water pills, diuretics, or if you are managing diabetes with medication, this plant can nudge those systems, and it must be cleared with the person managing your prescriptions first. Nettle can gently lower blood pressure and gently increase urination on its own, which is wonderful for some and dangerous for others depending on what you're already taking. This is not me covering myself. This is me having watched, over 30 years, what happens when a well-meaning person stacks a harmless natural remedy on top of a powerful drug, and nobody connects the dots. And now, the turn. The thing I've been holding back for the whole video. The fact that reframes everything. Because you'd assume the real value of this plant is in drinking it, in the tea, in swallowing those compounds. And that helps. But the single most striking use, the one those Roman soldiers understood in their bones, and the one modern research keeps quietly circling back to, is applied to the skin, directly over the aching joint. The old physicians pressed it against the swollen knee on purpose. Modern studies took gloves off, applied fresh nettle to arthritic hands for 1 week, and a meaningful number of patients reported real relief that faded when they stopped. Think about what that means. A joint that has been screaming for years, calmed not by a pill filtering through the kidneys and battering the stomach, but by a plant pressed against the skin over it, working locally, where the fire actually is. That is the twist. We spent a century looking for the answer in a bottle we could swallow and sell, and part of the answer was growing by the fence, meant to be laid right where it hurts. Here is what I need you to walk away holding on to. Your joints are not simply wearing out like old tires. They are the site of a slow, chemical fire, and after 60, that fire changes everything about how you must treat them. The daily painkillers that nearly everyone over 70 reaches for do genuinely quiet that fire, but they quiet it by throwing a blanket over your whole body, starving kidneys that were already running at half capacity, thinning the shield on your stomach and straining the heart, all silently, all without warning, until the day the alarm you muffled turns into a hospital admission. And meanwhile, growing free by the roadside, cursed by gardeners, dismissed as a weed, sits a plant that fed the joints of soldiers and healers for 2,000 years, carrying the silicon your connective tissue is starving for, the vitamin K that keeps calcium in its lane, and the quiet compounds that whisper to the inflammation instead of clubbing your entire body unconscious. Not a cure, never a cure, but a real, honest, low-cost lever. One more way to protect the thing that actually matters. Because remember where we started. I told you your knees are a silent clock that can stop one morning around 4 a.m. And now you understand why 4 a.m., that's when you've lain still for hours. The joint fluid thickens, the inflammatory chemicals pool undisturbed, and the fire, undistracted by movement, burns loudest. That 4 a.m. ache is not the beginning of the end. It is an alarm. And you now know the difference between muffling that alarm and actually turning down the flame. Margaret, the woman who feared her daughter bathing her more than she feared a fatal outcome. She is still doing her crossword in ink, still bathing herself, still independent years later. not because of a miracle. Because she stopped pouring fuel on the fire, rebuilt the muscle around her joint, watched her weight, and reached, carefully, wisely, with her doctor's blessing, for the weed in her own backyard. You have that same backyard. You have that same choice. The clock is ticking either way. The only question is whether you spend the years ahead muffling the alarm or finally answering it. This is Dr. James Whitmore. Take care of the machine you live in. It's the only one you get.